is being recorded like 5 seconds after you can go live.
Okay.
Right? Okay, go ahead.
Okay. Welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Joint Capital and Information Technology Committees. Today's meeting is officially called to order. I would like to propose the motion to adopt the minutes of the Capital Committee meeting held on November 5th, 2020. All in favor, say yes.
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 Opposed, say no. And that was myself, Dr. Katz, Vida Wang, Sally Hernandez Pinheiro, Barbara Lowe, and Scott French in a voting capacity for Stephen Banks. So next we will we'll hear the Senior Vice President's report, Ms. Flaherty.
Thank you, Chair Padan. Good morning. Today's one EITS contract resolution and one construction contract resolution are a culmination of efforts by our bidding team led by Ricky Tolick and our EITS colleagues led by Kim Mendez and Jeff Lutz. This past week, Health and Hospitals successfully opened our first COVID Center of Excellence at 1920 Webster Avenue in the Bronx. Opening these sites included tremendous teamwork with our office, Gotham Health, supply chain, and EITS, as well as tremendous great efforts from Perkins Eastman, our designer, New York City Department of Design and Construction, Gil Bain, and all of their subcontractors. The new COVID of Excellence site is designed to meet the unique needs of patients recovering from COVID-19, including specialized services like lung and heart care, radiology, and diagnostic services and mental health services. The site will also offer comprehensive primary care health services. In addition, the preliminary phase 1 construction completion milestone for COVID care areas was reached on the 25th at the Queens COVID Center of Excellence site. This means the equipment, the furniture, and cabling has to be completed before we can turn that site over. A special thanks to Michelle Lewis for her leadership and also Starlene Scott for getting us across the finish line. In addition, our OFD team has started work on the Outposted Therapeutic housing units. This is currently the largest capital program in our H&H portfolio that we're managing. This program will improve access to care for patients in our correctional system whose clinical condition requires access to specialty and subspecialty care. The 2 units will be located at Bellevue Hospital and Woodhull Hospital, with work currently scheduled for completion sometime in 2024 or 2025, depending on potential impacts. Our facility operations team continues to be busy with COVID-related work to keep our staff and patients safe. The team is currently working on providing as many hemodialysis tie-ins across our acute care facilities, providing patient visualization in each of our patient rooms where COVID care is occurring, providing high-level filtration in all of our high-risk areas such as dental. And in addition, our team has worked with supply chain and pharmacy, and we've provided the electric required to power the deep freezes for our COVID vaccine. We're happy to report that every facility has a deep freezer that is ready and power to begin storing the vaccine once it's available. Our contract team has been extremely busy on the issuing bid packages. We have seen a significant increase in the bid submissions from vendors per project. We're currently averaging 15 bids per project, and due to the increased numbers of bidders per project, our costs have decreased by an average of 17% from the cost estimates. And with that, I'll turn to the resolutions and happy to take any questions.
I have a question, Christine. It appears that we have selected our COVID centers in communities that had a high incidence of COVID. And I'm wondering if we're going to have special outreach to Harlem so that they can access the Brock Center, because they did have a high incidence. And I don't think that we're going to be building anything in Manhattan.
So that's a great question, Sally. I think that I would definitely want to be answering that in tandem with Michelle Lewis, our CEO at Gotham. I think that we internally are definitely socializing the value of these COVID centers to all of our hospitals from an ambulatory care perspective. And I will follow up with you regarding, what outreach we can do with Harlem Hospital specifically, because you're right, it's not that far away. Our two
Right.
closest hospitals are Lincoln and NCB, but Harlem is not too much further away. I would agree.
Thank you.
Thank you.
Hi, this is Seniaski. Is there any other questions from any other board members?
No, thank you. Great report.
Thank you. Christine, I just have a question, and is that, I noticed that a lot of times we do not communicate the transportation link between different kind of facilities. And I think following up on Sally's, is there a way to either develop a communication strategy that some of the people or the patients that will go normally to Harlem Hospital, they know what public transportation links are between Harlem Hospital and the COVID centers, because that will kind of clarify for people that we are trying to interconnect all these facilities and they are not totally separated, and we are actually thinking through how the people can visit and go to one facility to another.
That's a great question, Faniowski. I think that we're going to take that feedback and look at our communication strategy as an organization. I do know as a patient at H&H, we do leverage my chart for certain types of announcements by telling all of our patient population. And we also, in our communication about centers, we also communicate the ways to get there. So we communicate the Tremont stop is right there. It's, literally less than a block practically from the 1920 Webster site. So I know in all of our communication, we do point out how to get there. It's just a question of how do we link that with other ambulatory patients. And so I think your questions are good ones that we'll take back. I just want to make sure I collaborate with my colleagues on how we fully answer it. But these are all great points for us as we look to increase our capacity and patient volume at the center now that it's open.
Okay.
Christine, are we considering any transportation to facilitate this? It's proper well.
I don't think that we today, I think we have a number of ways individuals from the public can get to these locations.
There's a senior population in Harlem, and I was just thinking about them.
So again, these are great questions. This is a little outside of my wheelhouse, what you're asking me.
Okay.
I'm not we're not operating the facilities, so I don't have my Gotham colleagues with us, or Ted Long or Dr. Wallach, but we can absolutely take these comments back. And I believe we do provide services for our patients that require assistance from a senior's perspective.
I'm hearing this, and we do. We have a variety of ways that we provide vouchers for people to travel. But I think it's a great issue, and we will ask that ambulatory care address it.
I have one last quick comment. Metro Plus is going to be sending out thousands of food boxes to the most vulnerable seniors in the city. And so you may want to see if you can include something that discusses the COVID center for the mailings that go out to Harlem and the Bronx. You could take that back to Gotham.
Yeah, that sounds great. That's a great flag, Sally. That's a good connection point. So I will be sure to connect back with the Gotham team and let them know. We are, I was there yesterday assisting with a tour, and we have folks on the street giving out flyers, letting them know the center's opened. Also, there's a grocery store right next to the center, which Gotham plans on doing some collaboration work there with the grocery store. So that is good to know, and we definitely want to leverage that information. What's the timing of those boxes, Sally? Do you happen to know, or?
And I can find out for you, Christine.
I'll reach out to Talia.
All
It's
right,
fine.
terrific.
We'll coordinate amongst ourselves.
All right.
That's exciting. Okay, great.
Actually, following up on the Barbara's comment, I know that Matt has been working with the transportation group on identify kind of creative ways to support our patient population. So maybe you also would like to talk to him and his group on those issues of transportation between the hospital and those COVID centers.
Absolutely. Thank you.
Yep. So with that, I think, Christine, you have several resolutions that you would like us to consider?
Only two.
Okay.
Which is great.
Wow, that's a very, very light.
I think it's a record.
Yes, yes.
So our first resolution is a request authorizing the New York City Health and Hospitals Corporation, NYC Health and Hospitals, to execute a contract with Rising Sun Construction LLC, the contractor, for an amount not to exceed $12,425,781.30 for construction services necessary for the reconstruction of the exterior facade rehabilitation at New York City Health and Hospitals Harlem Hospital Center, the facility, with a 15% contingency of $1,866,453 for unexpected changes in scope, yielding a total authorized expenditure of $14,292,234, with a total project budget of $16,527,512. And so now we'll go into the presentation. I'm not sure if Ebony was able to join.
Yes.
I am. Good morning.
Good morning, Ebony.
How are you?
Good. How are you?
I'm well. And I just wanted to jump in earlier to all the comments that the board has. We will fully collaborate on the type of materials and the patient education that would be required to really seamlessly make sure that patients get from their point of care to any of the testing sites. But we also do have a very robust and active COVID testing center on site at Harlem Hospital. And there's also about 2 blocks away, a Department of Health testing center as well. And so we do have many materials that even if the lines get long, that we use to go back and forth so that people cannot be deterred from testing based on long lines or wait times. So that has definitely been done between ourselves and ambulatory care. The project background is outlined here. And what I wanted to lend to the conversation, Christine will talk through all of the construction aspects, but these buildings have really reached conditions that are significantly beyond remediation. The sidewalk sheds around the MLK Pavilion in particular, up 135th Street and around to Lenox Avenue, as well as on 5th Avenue for the Kuntz Pavilion, actually serve as very dark locations in the evenings and throughout the winter months. The feedback from some of our community advisory boards and community partners is that there are safety concerns, which we have tried to address over the many years that we've had the sidewalk sheds up. However, approval of this resolution would allow for us to have a project plan and be able to appreciate how we can move forward in addressing the exterior facade and roof work so that we would be able to take these sheds down, ultimately giving a better aesthetic to the facility and also addressing several of the community concerns that have come forward. So I don't like to read all the bullets. I think they're already well specified, but I'm glad to ask questions operationally or programmatically from the hospital perspective. And I'll pause there.
Thank you, Ebony.
Ebony,
Yes.
I have a question about the historic aspect of these buildings. I know that there are a few, some of the sites, Harlem sites that are, such as the building where Martin Luther King took a picture after he was a patient there. Are there any, because when we do this work, it should be recognized and that it is a historic. There was some significant events connected to some of your sites, some of your properties.
Absolutely. Thank you. I believe that's Ms. Lowe who asked the question. Thank you. There are currently on the campus no designated historically preserved landmarks. However, the facade work is actually not going to compromise the look of the MLK or the Coons Pavilion, specific to the very large statue that we all know and love in front of Harlem Hospital. That will be undisturbed. The general look of the facility will stay the same. It's just that there are several bricks that are buckling. There are components of the wrapping that are ready to actually be removed from the external facade. And so we are just really going to make it safer. We don't have any plans to modify the exterior of either of these buildings, aside from the work that's been specified for the construction. And so every other component of this project does not disrupt the aesthetic or the external perception. Christine, if you want to.
Sure. So we'll go to the slide 3 for a minute. So this work is, as Ebony pointed out, this is life safety reconstruction that's required in order to keep the community and the building safe and secure under the facade safety and inspection program that we have in place. This will allow us to remove a number of DOB violations and ensure that we are in compliance with the exterior facade structural integrity. And so this is one of many projects like this across our system where it's a function of just age of the building. And we need to ensure that we take care of that and try to get this work done so that we can remove sidewalk sheds, which is one of my big goals for our system, since they tend to be long-standing structures that tend to be our neighbors, which we are looking forward to getting rid of. So next slide. The construction contract here was sourced via public bid. This is a capital funded project, and Rising Sun Construction Corporation was our lowest bidder of 16 bidders. They presented an MWBE subcontracting utilization plan of 31%, and their low bid was $12,425,781.30. The MWBE amount is here. The services and subcontractors are listed above. And this contractor had some public experience for the Postal Service and MTA, but not specifically at New York City. And so there was not a MOX evaluation. We did outreach to the prior organizations that they completed work for, and there were recommendations provided by Postal Services and MTA. And so we feel comfortable with this organization coming into our fold as one of our contractors. And we expect the project completion after contract registration and NTP to be completed by 2022. This shows you the total project budget, which is indicated in the resolution at $16.5 million. We wanted to transparently share where the budget allocations are. We do anticipate the need for abatement in slight areas of this work, as well as a construction contingency, design fees, and as well as a design contingencies. Projects such as this lend themselves to unforeseen conditions. As we're taking and peeling the skin away on a facade, it's often that a designer has to come back and provide additional technical expertise and guidance to ensure that we fully address any potential additional structural issues that happen over time. And so we have contingencies both on the construction side as well as the design side here. We also plan on deploying a construction manager to help us manage this project and ensure that we meet the schedule indicated. And so finally, I'm ready to conclude. I'm not going to reread our resolution. I read it at the beginning, but we're happy to take additional questions should anyone on the committee have questions. Thank you so much.
Thank you, Christine. We really appreciated the thoroughness, and thank you, Ebony, for both the explanation about this particular contract and also about the great work that you're doing with the COVID testing and ensuring that our patients know where to go if things are getting too back up at your site. And so I will poll the member of the board to ask if they have any question. Jose Pagan?
No questions. Happy to see this happen taking place.
Thank you. Dr. Katz?
No questions. Thank you.
Thank you. Frida Warren?
No questions, and thank you to everyone as well. And Christine, I love taking down all the sidewalk sheds. I think that's a great goal. So thank you.
Sally Hernandez Pinheiro.
No questions.
Thank you. Barbara Lowe.
No questions. Thank you.
Thank you. Scott French.
No questions.
Thank you. Christine, I do have a question. Can you hear me okay, or am I having an echo?
No, we can hear you.
Okay, good. In the contingency, I noticed that you do have contingency for construction, contingency for architecture engineering, but for construction management, doesn't seem that you have contingency. Are you thinking that if the work were to prolong and you need to put more funding into construction management, that will come from the architecture engineering contingency or from the construction contingency?
I mean, it could, frankly. We have a healthier contingency than normal. I think it's a function of, at the time of when the CP was approved and the value it was estimated for. And so we do have, in this case, a level of funding that I feel comfortable should the job stretch out by, a couple of months if there's a really challenging, unforeseen condition, that we should be able to come within the total project budget.
Okay, and you have the flexibility to move that money from either the construction contingency or the architecture engineering contingency?
It would require an amended CP eventually, but I think that those are all achievable activities that are, have to be appropriately documented, but I think it's all achievable and well within the capital eligibility guidelines.
Okay, maybe in the future we can ensure that the contingency has that flexibility so that you don't have to go back through the whole process and you have the flexibility to move because if things get delayed, there is overheads associated with it. That would be my question. So I would like to now to poll the board members. How would you vote, Jose Pagan?
Yes.
Dr. Katz?
Yes.
Rita Wang?
Yes.
Sally Hernandez Pinheiro?
Yes.
Barbara Lowe?
Yes.
Scott French?
Yes.
Faniowski vote yes. Thank you. So we are going to submit this for the full board. So now we have the second resolution. Is that going to be presented by you or by Kim?
No, I will now hand it to my colleagues, Jeff Lutz and Kim Mendes.
I'll begin with the resolution and then we'll turn over to Jeff Lutz, our Chief Technology Officer, for the presentation. This resolution is requesting the authorization of New York City Health and Hospitals Corporation, the system, to execute a 3-year requirements contract with G Systems Incorporated, Coronet Corporation, and Mason Technologies Incorporated for structured cabling services and rack and cabinet solutions with the system, with 2 one-year options to renew such contracts with each firm and with the total cost of all 3 contracts over their full potential 5-year terms not to exceed $75.5 million. I will turn over to Jeff for the overview and the presentation.
Good morning, and thank you for the opportunity once again to present. And this morning I'm here to talk about something that's a first for the IT department within New York City Health and Hospitals. We will be entering into a contract for our cabling services as well as the racks. So what the cabling services is for our voice and our data to connect our endpoints to the desktop computers, mobile computers, printers, and even our medical instruments back into our network that allows them to communicate not only to our applications such as Epic, but leverage the internet and as well as provide the wireless access as well that's leveraged both by our own internal employees and clinicians, but our patients and our visitors as well. And so these would be the services that are performed. Generally in the past, we have done this on a project by project basis, where now this gives us the opportunity to be able to provide this service in an easier fashion and work with 2 very experienced vendors as well as another MWBE that allows us to help to broaden our base as well within Opportunity. So this would be a 3-year contract with 2 one-year renewals. As mentioned during the resolution, this would be a not to exceed of 75.5 million. And this estimate is based on our historical spend, both for that's done out of our expense or OTPS budget, as well as currently funded projects such as the network refresh, as well as just some projected potential future unfunded projects, but based on what we have seen for similar work in the past. And we would be, for the projects to be awarded once these contracts are signed, for large projects. So large projects would be generally ranging from like the balance of the 50 Water Street, all of the offices and the cubicles there, to the centers of excellence, to some of the clinics. Those we would be bidding out, and we do a mini bid to each of these vendors, and the selection would be based on the ability to meet the timelines as well as cost. But these smaller projects, so some of these could be smaller singular moves, adds, and changes. Some of this other work, we're going to be, depending on the scope and the size and the complexity, we will be awarding we're working with supply chain, and we'll be awarding these out at our discretion in order to, and especially it gives a good opportunity, as you'll see, one of the Coronet, for example, does not have a lot of experience within the hospitals, but this allows us to give them that experience and build up over time so that they can continue to add value for us. Next slide, please. So the procurement, the committee was made up of various members, both from EITS as well as our partners in OFD, as well as within EITS Finance as well. The criteria was MWBE as well as experience, their technical proposals, and their financial capacity in order to meet these large jobs, and cost. So the way that we did cost, because there's no monetary values assigned to these projects, they would bid on labor as well as the material that was provided. And based on these proposals, what we did was we took a couple of our previous projects, so for example, 50 Water and actually one of the centers of excellence, and we basically played out their pricing based on what the materials were for those projects, and did a comparison across each of the respondents. Next slide, please. So the procurement actually started in May. The RFP officially went out in September. We sent it directly to 4 vendors, and then we posted it on City Record. Then we held the pre-proposal conference call. By the deadline for the submissions, we received 7 proposals. 3 were certified MWBE organizations, and the remainder of the organizations agreed to meet the 30% MWBE utilization. Then the committee met, and based on the scoring, and we selected 3: G Systems, Coronet, and Mason. Both Coronet and Mason are MWBEs. What you'll see here on this slide, this talks about how we broke out the 75.5 million. You will see the expense totals, the capital totals. Again, the capitals are currently funded projects. In the expense side, you'll see a little bit lighter because we would look to start leveraging this contract this year, during this fiscal year. So you'll see 6 months prorated. And then again, future projects that are right now, as we anticipate capital needs, but these are not funded, but they would go through the traditional funding, and assuming that they do make the funding and are successful in that, then we would leverage these contracts for this as well. Below, you see our current historical spends for both fiscal year 19 as well as fiscal year 20. And as you can see, G Systems and Mason have both been excellent partners with us. We've been growing our business with Mason. We would not have made it through our Epic implementation if it wasn't for G Systems as well as our point-click care. implementation with Mason. They both were critical in getting a lot of wireless extended networks, and so that we could create and establish new desktops and meet the workflows and needs for both of those two large projects. Both Mason and G Systems as well have been very crucial in helping us with our COVID needs, anywhere from building out the surge sites to working with us on our testing centers as well as the mobile vans. And so we were excited to see both of them. Coronet is another company that we were happy to see. We've done business with them through other purchases of Cisco products, but they've never had the chance or opportunity to really work with us on the cabling side. So being a full MWBE, we look forward to working with them as well. One other piece I would like to note is the G Systems. Since 2019, we've been working with them, and to ensure that they've been meeting or exceeding the 30% MWBE utilization. And the way that they do that is that they purchase the materials for their jobs. So this would include the cabling, the racking, and any other associated equipment that's needed to build out this equipment through Network Building Technologies, which is a registered MWBE. And generally, these costs are at least 30%, depending on the type of project and what's required, will also generally exceed that. So, next slide, please. Thank you. And so, in summary, today we are looking for the ability to enter into these three: G Systems, Coronet, and Mason, with a 3-year contract, 2 1-year renewal options. Again, the not to exceed would be $75.5 million, but no monetary dollars would be assigned to any of these contracts. Payment is based on the actual services. We would have termination for convenience, no minimum requirements to any of the vendors. And again, Mason and Coronet are both certified MWBE organizations, and G Systems has committed and has proven to meet the 30% through their certified subcontractor. With that, I'll open it up to any questions.
Thank you. Thank you for the explanation. I would like to poll every member of the board for any question. Jose Pagan, any questions?
I don't have any questions. Thank you so much.
Thank you. Dr. Katz?
No questions. Very clear. Thank you.
Thank you. Frida Wang?
I do have one question. If we could go back to the estimates and historical spend, Jeff. On the I wasn't clear. The capital, the new needs, and in terms of estimating the future spend, the current capital is what we already have programmed in the budget. Is that right? And then what $9 million per year based on the new needs?
Yeah, so the current capital, correct, is currently funded and approved projects. The capital new needs, we just did basically a historical projection. We did a projection based on historical spend of, and a lot of things that influence that are just like the centers of excellence that we had. They're opening or renovating various clinics, as well as a lot of the moves or changes within the hospitals themselves. So we just kind of took an average of what we had spent over that, trying to eliminate anything that was very large, like an Epic. So,
right.
But they're unfunded, correct, at this point.
Okay, so this is just your estimate, and you felt comfortable with this isn't not to exceed the 75.5.
Right.
Okay, and then one other question I just noted, there's a big jump in 2022 on the expense. Well, I guess you said the 21 is prorated, right, for 6 months, but then the 22 is still somewhat higher than the future years. Is there something programmed in there, or?
No, so actually, if you look, that's really good. If you look at the operating expenses for 19 and 20, we were actually closer to that 3.1 million. So we're actually trying to, but you can see how we're trending down those costs. So we're trying to make sure that we pay for, as a lot of these other, what I'll call projects come into place, that we're paying for them through, put that as part of the funding and part of the approval with the projects. in the past, some of these smaller ones were paid for out of operating expenses. So that's why you see a little bit of a bump, and there's a couple other projects that we've held off on anticipating this project. And due to COVID that we know are not really projects, but work that needs to be done, moves, adds, and changes that we've really need to address, but haven't had a chance to address. And they'll get addressed between the end of fiscal year 21 and then into 2022. So that's where a lot of that.
I see. So that, but then going forward, 23, 20, you're trying to shift more into capital budget as opposed to paying it out of operating budget. That's
correct. Yes.
Okay. Great. Thank you. No other questions.
Thank you, Frida. Sally Hernandez Pinheiro.
I have no questions. Thank you.
Thank you. Barbara Lowe.
No questions. Thank you.
Scott French.
No questions. Thank you.
This is Senesky. I have a couple of questions. In this slide, in the historical spend, there is a big difference between G Systems and Mason spend. Is this due to their capability, their capacity to take on work? Can you explain why it's such a big difference?
Certainly. So a very good question. So it's a mix of a few items. The biggest one is traditionally that G Systems actually runs they're much lower cost provider. So in some cases by half. So it's something that we've been working with closely with Mason to try to see if we can bring it closer with that, as well as there's a familiarity unfortunately with that, but we're trying to move away so we're not dependent onto one vendor. Coronet in their pricing during this was actually closer to G Systems, so that's part of why we're excited to help to leverage them, and then feel that some of that pressure onto Mason as well will give us some additional cost savings there as well. But that's one of the biggest drivers of this.
Thank you for that explanation. And what about in terms of their capacity? Are they both around the same size, or is G System a lot larger? And sorry, I don't know too much about this company.
Yes, actually, they're both very relatively same size. They both have a large capacity. Mason currently holds the city's contract for this same type of systems. Coronet themselves were the previous holders of the city contract, so they are all very large. But we want to develop. That's part of what actually happened during Epic as well. We had so much work that was going on during Epic that G Systems was unable to meet the timelines that we needed within their capacity, and that's why we really heavily relied on Mason. They were able to step up and actually help us to meet some very tight timelines and windows there as well. So,
well, thank you. The other question that I have is with respect to the spend during COVID. I noticed that most of the spend, at least the one that is shown here, went to G Systems. Can you explain, again, I understand now the cost, which may be an explanation, but I just want to understand how that COVID spend was determined.
Yeah, sure. So, and again, it really came down to cost, and then availability inside of this as well, especially for meeting the very quick timelines that we needed to spin up. Or initially those surge sites, then secondarily the testing sites, because we do actually run a network within these areas in order to support the computers needed to do the testing and documentation around that testing.
And Fenny, it's Keith Talby, leading our MWBE efforts. Just wanted to also add, on all of these, we're doing quantitative scoring. So there's at least 10% considered on each of those. So, Jeff and I have been working very closely together on this, and that's one of the key initiatives on this group of contracts. All of these previously were done project by project. So this is one of our key strategic MWBE goals, is to move this forward and have a more contract managed approach to it so we can track our MWB utilization on this group of contracts. And, just making sure that that COVID piece there was the result of a considered process with discussion with the vendors and a lot of back and forth.
Well, thank you, Keith, for the explanation. If we can go back to the previous slide, I just want to, and this kind of connects well with what Keith was mentioning. I'm very impressed with your kind of outreach program here. For example, you said that you have reached to 4, but then 3 more came in, or maybe more. Maybe one of those 4 that you outreached didn't participate. But what I was impressed is that you had a 40% response rate from MWBE. Can you elaborate a little bit more on how that may have occurred? Is that there is a large pool of MWBE in this space? Or is that you have, as Keith mentioned, making this a strategic kind of initiative and you increase your outreach programs and those were very successful?
During the pre-proposal conference, we actually, I think, had closer to, I believe it was 11. I can go back and look, but 11 respondents. But right, within the three MWBEs, obviously, 2 of them were known to us, Coronet and Mason. Those were 2 of the vendors that we reached out to directly. And then there was a third that had joined, that had been a part of it, and that actually they came in, I believe, through the city record. So seeing it out there, there are a lot of there seems to be a big pool. How many of the MWBEs are represented in there? That's a good question, but the challenge that we had was with some of these, was it 2 things. For experience inside of healthcare, especially inside of hospitals, and which is very crucial, not only from a regulatory, but understanding and how to work within that hospital environment, as well as meet the capacity to meet the needs were the challenges that we saw within there. But that's why we were hoping to be able to bring along a Coronet. If this experiment works well, as Keith had mentioned, we've been working with them as this initiative to help improve that. As this contract expires, hopefully it opens us up to do something similar in the future as well. So
thank you. My last question is that you were mentioning that this is a new approach that you have taken, moving away from project to project to more like a on-call requirements contract. Is there any management approach that you are adapting to ensure that this will be successful and even more than the project by project?
We're as I mentioned, this is new, a little bit new on some of these pieces. So the projects, the larger part would still be awarded based on those project by projects, but the smaller part, that's what we've been working close with Keith and the supply chain team to help us so that we can better manage that. And we've been working very closely with, Keith and then Renee, Olivier within supply chain. They've been very, very helpful for us so that we can work on that process where we have a little bit more discretion.
I'd also like to say that, one of the things that will help us with is our efficiency and our timeline to move into the next project more quickly. So one of the metrics we will, take into consideration is how quickly can we move to that next project. Some of them are planned, some of them are, they come to us, particularly in this era that we're in right now. So I think the turnaround time, if you will be a good metric for us as well.
Yes.
Thank you. Is there any other questions? I'm sorry that I had so many since I was asking too much. Okay, so in that case, let me go and ask for the vote for each one of the members. Jose Pagan?
Yes.
Dr. Katz?
Yes.
Frida Wang?
Yes.
Sally Hernandez Pinheiro?
A big happy yes.
Barbara Lowe?
Yes.
Scott French?
Yes.
Peniowski vote also yes. I think with that we concluded all the two resolutions. Is that correct?
Yes.
So is there any old business that we should be looking at? Any new business? With that, if we don't have, actually, this is one of the meetings that we are able to complete early. So we found ourselves 11 minutes. So thank you, Kim. Thank you, Christine. And so with that, I will adjourn this meeting. Thank you so much, everybody.
Thank you.
Bye.
Thank you.
Bye-bye.
True.
Thank you. Take care.
Bye-bye.
Everybody.
Bye-bye.
Thank you.